beam restricting devices, focal spots, and filtration. Beam restricting devices are used to control field size and reduce the amount of tissue irradiated. They work to increase or decrease collimation and to reduce patient dose and scatter. Focal spot size is the surface area of the anode target that is struck by the electron beam to produce X-rays. Filtration is used to create a uniform exposure on a radiograph when imaging an anatomic part with varying tissue thickness. Beam restricting devices are an essential part of creating a diagnostic image. These devices are used for each radiograph taken and work to increase or decrease field size to only capture the anatomic area of interest. Decreasing field size to show the area of interest only will reduce patient dose by decreasing tissue irradiated, and in doing so will also decrease the amount of scatter produced, creating a quality diagnostic radiograph. There are three types of beam restricting devices: aperture diaphragm, cones and cylinders, and variable aperture collimator. An aperture diaphragm is a flat piece of lead with a hole in the middle that attaches to the X-ray tube head. The aperture in the diaphragm is designed to cover most of the image receptor that is being used. These devices are the simplest design of beam restricting devices because they are easy to use. Aperture diaphragms have a fixed lead opening, meaning that the field size cannot be adjusted. Furthermore, because of how close these devices are to the source, they create a large amount of unsharpness surrounding an image. Aperture diaphragms are not commonly used today. Much like the aperture diaphragm, cones and cylinders are easy to use and attached to the head of the X-ray tube just below the window. Attached to the aperture is a large cone or cylinder, which is used to limit the amount of unsharpness surrounding the radiograph. Cones have a slight disadvantage compared to cylinders because if the angle of the cone is greater than the divergence of the X-ray beam, it may actually restrict the primary beam. Cones and cylinders are designed to create a circular field size, which can increase image quality in certain studies. An aperture collimator is considered to be the most useful, accepted, and the best of beam restricting devices in X-ray imaging. Collimators consist of two shutters that can be adjusted to create variable field sizes, producing adequately collimated images with square or rectangle borders. Collimators are equipped with a white light, mirror, and a red laser to display where the primary beam is projected, and also to indicate centering point to ensure accurate positioning of the beam. It's important to note the relationship between increasing or decreasing field size and collimation. So this is just a visualization of these terms. So in the first image, we're starting off with a small field size and we're expanding it. So that means that our field size was increased, but our collimation was decreased. And the opposite here, we're going from a larger field size to a smaller field size. So field size was decreased and collimation was increased. Focal spot is the surface area of the anode target that receives a beam of electrons from the cathode and is considered to be the origin of X-rays. The size of the focal spot is dependent on the strike and shape of the incoming electron beam strike and is responsible for sharpness and spatial resolution of a radiograph. Increasing focal spot size will decrease recorded detail, and decreasing focal spot size will actually increase recorded detail. It's generally ideal to use a small focal spot size to maximize recorded detail. However, a large focal spot may be used if a shorter exposure time is necessary. Beam filtration is the use of metal sheets that are between the X-ray tube and the collimator. The main purpose of filtration is to absorb low-energy photons that don't contribute to image quality and increase patient dose and scatter. There are two types of filtration, added and inherent. Inherent filtration from parts within the X-ray tube includes cooling oil, window, housing, and the anode. Added filtration is tailored for specific examinations using various types of metal with varying thickness to improve image quality. Another form of filtration used is called compensating filtration. These types of filtration devices are generally placed on top of the patient in the primary beam during exposure to even out thickness in the anatomic area of interest to alter beam intensity. There's three main types of compensating filters that are used a lot during our studies. They're called wedge filters, boomerang filters, and trough filters. To use these filters, we place the thicker part of the filter along the thinner part of the patient, and the thinner part of the filter along the thicker part of the patient to even out tissue for even penetration. Each of these devices are useful tools to use to enhance the quality of our radiographs and should be used according to each case. Each patient will have a different condition and body habitus. Therefore, adjusting accordingly is essential to creating a high-quality diagnostic image.